New at 11, the Florida Department of Health now issuing controversial guidelines when it comes to the care of transgender children.
State officials are now splitting from the feds, but some parents say it feels like a violation of rights. News 6's Treasure Roberts is here to explain.
I feel like is kind of they're kind of turning their backs on these kids.
The Florida Department of Health is going against new guidance from the U.S. Department of Health and Human Services on the treatment of gender dysphoria. It's a condition the American Academy of Pediatrics describes as distress stemming from one's expressed or experienced gender and the gender assigned at birth. The state claims there's a lack of evidence and potential for long-term irreversible effects, listing the following guidelines. Social gender transition shouldn't be a treatment option for children. That's when a person uses a different name or pronoun. Anyone under 18 should not be prescribed puberty blockers or hormone therapy. And gender reassignment surgery shouldn't be a treatment option. The guidance criticized by several people on Twitter. One person writes, setting the stage to prosecute parents who support their children, just like Texas.
We're going to see more of these anti-trans bills coming into the state of Florida, and this is going to be used as quote-unquote proof to support these bills and them being passed.
Marnie Balasuknia has a transgender daughter. Even with a supportive family, she says her daughter experienced depression, anxiety, and suicidal thoughts.
If I were to say, well, you can't, we have to stop. You can't continue taking your hormones. We have to stop the transition. I don't know what would happen. I mean, I can't really bring myself to go there because it's really scary.
Dr. Jason Rafferty has written American Academy of Pediatrics policy for care of gender diverse youth and points out, quote, inaccuracies in FDOH's guidance, saying the department is looking at treatment through a black and white lens.
Using somebody's name, allowing somebody to style their hair or wear certain clothes are not irreversible interventions.
Adding, the department opposed what AAP is trying to foster as the standard of care.
The guidance from FDOH really is a statement against really any form of gender affirmative care.
Now Marnie fears insurance companies will begin limiting coverage for these types of treatments.
If you take away their medical care, if you take away everything that's going to make them feel like their true self, I think even with support, it's going to be really detrimental to their mental health.
Marnie says this feels like a violation of rights, and she hopes this doesn't deter families from doing their own research and seeking quality care for their children. In Orange County, Treasure Roberts, getting results, News 6.